1,799, including 50,004 in Wuhan, taking up 74% of the total infections in Hubei. 17,795 cases were reported in the rest cities, taking up 26% of the total. As of midnight of March 16, the new cases of confirmed infections in Hubei were 1 from Wuhan. The number of new cases have maintained at single digit for 6 consecutive days. There were no imported cases reported in Hubei. Excluding Wuhan, the rest cities has maintained new cases reported for 12 consecutive days. Among them, Shandongjia, Xianning, Xiangyang, Xiantao, Tianmen, Suizhou, Yichang, Qianjiang, Xiaogan, Enshi, Shiyan, Jingzhou, Huanggang, and Jingmen, in total of 14 cities and prefectures, have reported 0 cases for at least 14 consecutive days. As of March 16, 2020, there still remained 8,004 patients in hospital, including 2,243 in severe condition, 539 in critical condition. As of March 16, the total fatal cases stood at 3,111. On March 6, 12 new deaths were reported, including 11 in Wuhan, 1 in Xianning. As of March 16, the cumulative discharged patients reached 55,987. On March 16, the newly discharged number was 893, including 836 in Wuhan, taking up 94% of the total amount in Hubei. Starting from February 19th, number of newly discharged and cured patients have exceeded number of newly confirmed patients for 27 consecutive days. Thank you. Thank you very much. Now I'll give the floor to Mr. Yuan Yufeng regarding the management work in Leishenshan Hospital, as well as the cooperation with other medical teams across China. Friends from the media, good afternoon. Wuhan Leishenshan Hospital, with more than 10 days and contributed by 100,000 workers, and is one of the designated hospitals in Wuhan for COVID-19 patients. And we also manage by the mode of 1+3. We had 32 wards, including 2 ICU and 30 normal wards with a bed capacity of 1,402. So far, we had the 16 medical teams from 9 provinces with 3,020 medics, as well as 660 supporting staffs. So total, we have 3,862 staffs in Leishenshan Hospital. Starting from February 8th, we admitted patients. As of March 16, so far we have admitted 1,961 patients, discharged 97. So far, we still have 942 patients in hospital, and is with the largest amount of patients in hospital among all designated hospitals. At the very beginning, we trained the staff and while constructing and also admitted the patients at the same time. And this is built for the wartime. That is why we also managed the operation in Leishenshan Hospital, also followed a high standard, stringent and high quality standards to monitoring our work. So to be specific, we have adopted the following measures. On the very first day, within 12 hours, we have established the overall organization chart, and the medical staff team and the logistic team, the party team, and the construction team. All these 4 teams worked closely and make sure we can have a very smooth admission. And second, by establishing the joint medical office, nursing office, and nosocomial infection management office. We have the unified standards to monitor our work in Leishenshan Hospital, and we also have conducted the expert panel to treat critical ill patients, as well as a TCM expert team, as well also a psychological consulting team. So we make sure we can deliver a good job to treat the patients as well as nosocomial infectious management. Fourth, we also have identified and classified the patients, make sure we can take a proactive approach to treat our patients and blocking the way for the patients from a worsening of their symptoms. So far, based on the results, all the medics actually showcased their expertise and devoted to the work, and the whole teams have risen to the challenges. And so far, we have seen that the epidemic prevention and control has entered to a new era. By showing a decreasing number of newly confirmed cases and increasing number of discharged patients, and we should not relax. And based on the requirements given by General Secretary Xi Jinping, we should strengthen our efforts on controlling the quality of patient treatment, as well as giving a top priority to treating the critical ill patients in order to lower the mortality rate, and also make sure there is no infection happened within the hospital, and protect well our staff, and to win the battle against COVID-19 at an early date. Thank you. Now I give the floor to Mr. Xu Yinghui to introduce the work delivered by Liaoning Medical Aid Team to Leishenshan. Friends from the media, on the afternoon of February 8th, we received the order to support Leishenshan. Just within the 4 hours, we have gathered 511 medics and arrived in Wuhan at the very early morning on the second day. In Leishenshan Hospital is well constructing, checking the quality and admitting patients. Liaoning Hospital has taken charge of 17 wards and received the patients within 1 week. For the 11th batch, with more than 100 staffs, and transferred to Leishenshan hospitals and in charge of the 11 wards. Right now we have 1,018 the staffs and in charge of the 1,166 patients. And on top of the National Health Commission, the designated treatment plan, and we also add in the psychological consulting part into the protocol, and we also have emphasized on the TCM plus Western medicine. So we have the one TCM experts in our team, and we have the critical ill patients at 98 years old, and also the one patient with 62 years old, the liver transplant was cured and discharged from the hospitals. And we also have established a telecommunication platform, make sure within the hospitals, outside the hospitals, and also the conference can conduct it in different areas. Leishenshan as the largest area of the designated hospital, Liaoning as the largest, the biggest team in total of the number of people, and we will never relax our mind, and we will also strengthen our efforts to continue our work to treat the patient, and we will not lightly announce a victory until we win at every front. Now I give the floor to Mr. Leng Xiangyang. Friends from the media, good afternoon. The 4th national level TCM experts leading Jining team, led by the affiliated schools, Tangchun TCM schools and the Jilin TCM Association, and Jilin TCM and Western Medicine. So in total, 5 universities and organized a group of experts to Wuhan. We arrived at Wuhan on the beginning of February, and we have taken over the infectious disease ward in Leishenshan Hospital, and we admitted the patients on 19th of February. So far, we have admitted 75 patients. 32 were cured and discharged. We have stick to the early involvement of TCM and also the elaborate strands of TCM and Western medicine, and follow the 7th edition of the protocols issued by NHC, and we for sure to conduct the unified DA standard to treat the patients, make sure the patient can enjoy their personalized DA plan, and also they better leverage the strengths of both TCM of the Western medicines, and we also has used the physical therapy from CCM that widely used to our patients, like the acupuncture, the Tai Chi, or the deep breathing exercise like Baduanjin. Make sure we can use all different ways to treat the patients, let them have a good recovery period. We will work hard and earnestly, and we will never relax our mind and also not really blindly upbeat. And we will keep up our efforts to win the battle against COVID-19. Thank you. Give the floor to Mr. Zhang Jizhong to introduce the work delivered by the Shanghai medical team. Friends from the media, good afternoon. The 8th batch of the Shanghai medical team arrived in Wuhan on the February 8th. It organized the 6th medical team from Shanghai, the Liaoning Hospital, Shanghai 1st Hospital, Shanghai 6th Hospital, Shanghai 5th Renmin Hospital, Yanghu Central Hospital, so 102 doctors, 306 nurses, 13 nosocomial infectious management staff, and we have taken charge of 4 ICU with 192 work beds and 1 ICU with 31 beds. During our work in Leishenshan, and we also bring our unique strengths from Shanghai. First, we manage our work in detail-driven manner, and the doctors with a different background, and we actually regroup our experts for the department. The doctors from Department of Respiratory Medicine and the infectious disease, and also the doctors from the key departments that are to the ICU, also like the doctor from the anesthesiology, and make sure we have the strong team in ICU. And also within the ward, we also have the working platform, make sure we can provide the psychological counseling to our patients. And we also have the 3 level of ward inspections, and we also have the different teams in terms of the CRT, ECMO, the heart disease team, the kidney disease team, as well as the intubation team. So we also work with the team at our home base, and we also prepared the things that are the need at the front line and sent to the front line through the telecommunication. And we also have formulated the working process, and we also have the peer evaluation, and also have the detailed record their time they enter into the working places, when it's time they living, and also the whole process of the end-to-end monitoring. And I also have organized the team of experts, follow the 7th edition of protocol issued by NHC, and also the documents issued by Shanghai in terms of the disease, the cytokine storm, the respiratory support, and we have seen a good result in this regard. As of March 16th, we have admitted 240 patients, 111 severe and 28 critical condition. 65 was cured and discharged. So far, our DA staff is in the high morale and in full energy, make sure we can win the battle. Thank you. I'll give the floor to Zhou Xu to introduce the Guangdong TCM team to Leishenshan Hospital. Friends from the media, good afternoon. I would like to briefly introduce about the work delivered by Guangdong team in Leishenshan Hospital. The 4th National TCM Guangdong team, organized by Guangdong TCM Hospital and the Shenzhen Hospital, with 60 people, 16 doctors, 44 nurses. On February 17th, we arrived in Wuhan. On the 18th, we started our work in Leishenshan, organizing the infectious disease and managing 48 beds. On February 20th, all beds occupied. So far, we have admitted 99 patients. 69 was cured and discharged. Among them, TCM participation rate is 100%. Patient with only TCM was 35, and we have 3 experience in this regard. First, we should fully leverage the strength of TCM Western medicine, and that can give us the early understanding of the disease development. And we also conducted targeted treatment to improve the cure rate and lower the mortality rate. Based on clinical practice, the patients with critical or severe condition give the oxygen therapy, antivirus treatment, and life-supporting therapy. On top of that, they use the TCM prescription as well as acupuncture. We have seen a good result of this practice. Second, the early involvement of TCM can help us to early wipe out the virus and also have seen the good effect. Where TCM had a good on the coughing, high fever, and also can have a good effect on the blood oxygen saturation and protecting the heart, liver, brain, kidney. For the mild and common symptoms, you can see that their symptoms can muchly improved while blocking to severe or critical conditions. For the critically ill patients, the combination of TCM medicine and can help them to shorten the time that are harming the internal organs, as well as shorten the time of using the oxygen inhalation. And based on the different condition of the patients, and we also make sure that we have the syndrome differentiation, make sure each patient has its own formula. Going forward, we will do everything to treat our patients, make sure more patients can be cured and discharged from the hospital, and finally win the people to work. Thank you. Now the floor is open. Please identify your media affiliation before asking questions. It's China Daily. Wuhan Leishenshan Hospital is admitting patients while constructing. So far, we have more than 4,000 workers from different hospitals. In this very complex background, how you make sure there's no medics were infected. Thank you for your question. As you mentioned, regarding the nosocomial infectious management is one of our top priority on our working agenda. As you mentioned, we admitted patients while constructing the hospitals and also our staff coming from different areas around China, how to make sure we're well protected, our staffs, doctors and nurses, that always our top priority. And we have done this work in the following areas. First, we have established a expert team that are good at the controlling infections in the hospital, and we have the Professor Liu Yi with rich experience, and he actually is the person to organize the working process, the working standards, and design the SOPs and the channels in the Leishenshan Hospital to make sure from day one, Leishenshan actually operated with the highest standard of nosocomial infectious management. And the second, for the nosocomial infectious management training, we not only give our training to the medics, we also give to the all people involved in the Leishenshan hospitals, and we also give multiple training to them, make sure everyone know from A to Z about how to protect themselves in the hospital. And third, we also do a good job on monitoring. First, we monitor their behaviors. For example, like putting on and getting off the protective suits, we have CCTV, make sure we can give the guidance and also monitoring their behaviors in a timely manner, make sure they can operate all these in a safe way. And second, we also monitor the health condition. We have a daily reporting system. And third, we also do a good job on the environmental check, and we have a 44 mobile checking station. Every day we have the data upload to the nosocomial office, make sure the working places is good enough, safe enough for all the people working in. And by all these, that help us to do a good job in nosocomial infectious management, make sure patients and staff are all safe. Liaoning Daily. We have seen in the media coverage that the Liaoning cultural wall in Leishenshan Hospital. Would you please talk more in this regard? Thank you for your question. Regarding Liaoning cultural wall, actually, it's not only belong to Liaoning. Actually, this is really well welcomed. A lot of medics, as well as workers, the firefighters, the logistic people, actually all involved in creating this kind of cultural wall in Leishenshan Hospital. This is another highlight in Leishenshan Hospital. Talking about inspirations, actually, this is based on a modern medical science. So this is the medics not only need to treat patients physically, we should also focus on their mental and the spirit, the soul. We talk about in and outside of the whole patient. That is why we emphasize so many times during the treatment that we should focus on the humanity part. So talk about this is COVID-19 as an infectious disease. So the medics actually every time they're wearing hat to toe, the protective suits, and also our medics from different areas, so we're speaking a little bit different languages. And that's also we have a different way of working, so that make the whole thing a little bit complicated. So actually at a very early day, they wrote their name on their protective suits, or they saying like fighting on, we're from Dalian and we're from Liaoning and we come here to help you, so you do not even panic. So actually patients really like this kind of way to expressing the message, and also patients wrote the message. And also the doctors wrote the message to the patients as well. So you can see this is really a good chemical going on between the patients and doctors, as well as nurses. And also we talk about the corridor before. This is really cold, long corridor. So our medics actually utilizing their leisure time to do some creation. So we talk about Dali. Actually, we have our seafood and we have our bridge. Like from Jinzhou, we have a different landmark, and also talk about Wuhan, like different food, the famous dishes, the landmark buildings, the sightseeing places. Actually, these all you can find along the corridor. So people actually not only for the medics, also for the other people involved, they all made their contribution. Make sure this is kind of another park, another entertainment place for people to relax. Actually, this is what we call the cultural walls. I believe by having this kind of cultural walls, this before just a really cold corridor. Right now you can see we have bring a lot of warmth inside the hospitals. I believe that also another way, another spirit or the encouraging part for all the doctors and patients to fight against COVID-19. From Jilin. So my questions regarding TCM, how TCM actually play its role in treating patients. Thank you. Regarding the feature of TCM, I believe that should be the A syndrome differentiation. So for us, actually, we have taken over in one ward to make sure we can understand the patient's syndrome, and we look at their tongue, and we also feel their pulse. So we actually focus really closely to the patients as well as their syndrome. So based on the local weather, seasonal features, and we can add on or have the different descriptions for different patients. You more or less think they all COVID-19, but actually different patients in different conditions. So that is why for us, we need to first identify syndrome and give different prescription. For the patients in our wards, a lot of them actually above age 60 with chronic disease or underlying disease. By utilizing TCM, actually not only can treat COVID-19, it also good to help them to treat the other diseases. For example, some patients had high fever, or some patients actually with the other disease like the constipation or the really hard to sleep. We utilize the physical therapy such as acupuncture, the TCM formula. So we add in some formula or taking some formula out. Make sure we based on different syndrome of patients, we can give the targeted prescription to the patients. And we also use TCM can cure the different disease. So based on our clinical practice, we have the TCM, the disease development period. So at different period, we have different prescriptions, we have a different treatment protocol. So this is actually a differentiated, leveled, symptom-driven practice. Actually have seen a good results. So besides giving the basic treatment and using TCM together that can cure the mild symptoms of COVID-19 and can cure the mild patient. For critical ill patients of COVID-19, by giving the ready-made TCM and also the decoction of TCM can help to improve the symptoms of patients and improve the cure rate. Thank you. Shanghai TV. In Leishenshan, actually have a very special marriage ceremony, and just like a 10-minute about this ceremony. And would you please talk more about details why we have this a battlefield wedding ceremony? Yu Jingkai and Zhou Lingyi actually nurses born after 1990s. So the couple actually, their original plans in Shanghai on February 28th, because a sudden happened of COVID-19, the couple actually activated response to the call of the hospital, and they worked in Leishenshan Hospital in ICU wards. In the evening of February 27th, the medics actually planned a very simple wedding ceremony because the majority of shops actually not in operation. So Leishenshan and Jingxia Shelter Hospital help us to prepare a cake. And also the local government actually heard the story, also invited media to cover the story, and also suggest us to bring this wedding ceremony to Leishenshan Hospital. So in the afternoon, so that's around 5 o'clock. As a 520, we know that meaning. That's because I love you. That's also why we picked this time, 5 p.m., 5:20 p.m. We have this wedding ceremony. So we invited the CCTV, the paper, and around in total 30 media is invited. So the netizens actually also give the best wishes to this couple, seeing that a couple actually work together on the front line together. This is something really can remember for their whole life. This is something we believe is more meaningful than just spend a honeymoon in different areas. We believe this is really a good story, a touching story, and also very encouraging for us, and also have more confidence to win this battle. And one last question. Question going to Guangdong. They mentioned that the Guangdong TCM team actually also have quite a good practice. Would you please share us the one example regarding the TCM treating critical ill patients? Thank you very much. On the day one, actually we admitted one female patient treated 3 weeks in other hospital, but still have the respiratory difficulty, fever, dry cough, the fatigue, hard to sleep. So we admitted this lady, and we found the heart rate is 120, the blood saturation just 90%. So on the same day evening, we treated her by combining TCM and Western medicine. We also gave the anti-bacteria and as well as the TCM decoction, the acupuncture as well, and we also gave the oxygen therapy. So we gave her the occupation. She found that she really relaxed at that moment. So on the second day, when we conducted the ward inspections, the first thing she told us is like, I really slept so well. That's really a good sleep for me. So I also checked her CTs after giving the treatment for 2 weeks. So we still found that the inflammation in her CT scan. So we also changed the formulary in the decoction. So found that she not have that hard in breathing, and we also found it's not really thirsty. Right now the heart rate is around 80 per minute, oxygen saturation above 95%. So by combining TCM and Western medicine, the TCM decoction, acupuncture, at the 4th week of treatment, on March 14, she discharged from hospital by walking herself. So this is actually once a critical ill patient. So that's for us. It's like we should early apply a TCM to closely monitoring the development of the symptoms of the patients, and also let TCM play its role. Thank you all the speakers, and as well as our friends from the media. Let's make today's press conference. Thank you.